At midnight, you wake up because of a severe pain in your big toe. No impact. No injury. Before going to sleep, you were completely normal. But the pain is so intense that you cannot touch it. Even the blanket feels too heavy. Many people think it's just ordinary joint pain. But this is what many people don't realize. It could be gout. And the important thing is, this pain does not appear randomly. In this video, I'll show you what's really causing this pain, how to relieve it quickly during a gout attack, and what you should eat and avoid to keep it from coming back. Part 1. Why do you get gout? Everything starts with a substance in your body, uric acid. Every day, your body produces uric acid when it breaks down food and natural substances. Normally, the kidneys filter and eliminate it through urine. But when the body produces too much, or the kidneys cannot process it fast enough, uric acid begins to accumulate in the blood, and over time, it crystallizes into tiny needle-sharp crystals inside the joints. These crystals trigger a strong inflammatory reaction and create the intense pain of gout. Not everyone with high uric acid develops gout, but if this condition persists, the risk increases over time. And the dangerous thing is, you can have gout for years without even knowing it. Part 2. Gout symptoms. Gout does not come slowly. It comes very quickly. You can be completely normal in the evening, but wake up in the middle of the night in pain. The pain usually appears in the big toe. The joint becomes swollen, red, and hot. It feels like something is stabbing from the inside. Even a light touch hurts. The pain can last for several days, even up to 1-2 weeks, before it subsides. But that does not mean the disease is gone. If not controlled, the pain will come back, repeatedly, and over time, the crystals will accumulate into hard lumps under the skin, called tophi. At that point, the joint can be permanently damaged. Part 3. How to relieve pain quickly. When a gout attack occurs, the most important thing is early management. Avoid using the joint. Avoid walking or putting pressure on the joint. Apply a cool compress. Do not use ice directly to reduce swelling and pain. Drink enough water to help the body eliminate uric acid. And if needed, use anti-inflammatory medication as directed by a doctor to control the pain faster. The earlier you manage it, the easier the pain is to control. Part 4. What to eat, what to drink, and what to avoid. One of the factors that triggers gout is diet, and sometimes just one overindulgent meal is enough to trigger a gout attack. Organ meats, red meat, seafood, alcohol, especially beer, as it increases production and reduces excretion of uric acid through the kidneys. Eating too much in a short time can trigger a gout attack. On the other hand, you should drink enough water every day. Eat in moderation, avoid eating too much in one meal. Maintain a healthy weight. These changes do not eliminate the disease immediately, but help reduce the risk of recurrence significantly. Part 5. Diagnosis. Not every joint pain is gout, but if you have sudden, severe pain, occurs at night, focused on the big toe, then the likelihood of gout is very high. A blood uric acid test can help assess the risk. However, there is something many people do not know. During an acute gout attack, uric acid can still be at normal levels. Therefore, a single test is not enough to rule out the disease. A more accurate method is to examine joint fluid to look for urate crystals. In addition, ultrasound can show the double contour sign due to urate deposition. X-rays can detect bone erosion in later stages. Part 6. Medication treatment. Treating gout is not just about pain relief. It has two goals: control the current pain and prevent the disease from returning. Depending on the case, doctors may choose the appropriate medication. During an acute gout attack, when the pain flares up, Anti-inflammatory medications help relieve pain quickly. Commonly used include colchicine, ibuprofen, or naproxen. These medications help reduce inflammation and pain, but do not solve the root cause. Long-term treatment, most important. To prevent gout recurrence, it is necessary to reduce uric acid in the blood. Common medications include allopurinol, helps reduce uric acid production. Febuxostat is an alternative when allopurinol cannot be used. Probenecid helps increase uric acid excretion through the kidneys. The important point: these medications are not used for immediate pain relief, but for long-term control, and they need to be taken consistently. As prescribed by a doctor, many people stop taking medication once the pain starts to improve, and that is why gout returns, often more severe than before. Conclusion: gout is not just a joint pain. It is a sign that your body has been accumulating problems over a long period of time. The pain can come very suddenly, very intense, but it is completely manageable. If you have ever had such pain, especially in the big toe, do not ignore it. But if you understand it correctly and manage it early, you can completely prevent gout from getting worse. Thank you for watching. Don't forget to like and subscribe to the channel. Check out my other videos to learn more useful tips about medicine and health.